Thank you, Chairman Scott, and thank you, Secretary Walsh. I hope you're not getting too tired. We're in the middle of a job crisis, and I think that we all know that. There are currently 11.4 million unfilled jobs in America, and the labor participation rate is not at the level it was prior to the pandemic. And the constant refrain that I hear from employers in my district is they can't find workers who have the skills, and even if they don't have the skills, they're willing to train if they can find people to fill those jobs. And aside from the administration's focus on the outdated registered apprenticeship system, which doesn't meet the needs of most employers, what steps is the department taking to alleviate the shortage of skilled workers and respond to employer needs?
Thank you very much. I think the first and foremost, just to kind of put this in context, the challenges that employers have today isn't new. The challenges employers are facing today, and that it's kind of highlighted or magnified because of what we've gone through as a country over the last 2 years with workers and pandemic and people getting sick and dying. And I think that, the investments that and again, I can't speak too much of what's happened at the Department of Labor in the past, but our focus moving forward is really creating a pathway. I think as a country, we've focused on just college, as I mentioned a minute ago. We haven't made investments in skilled trades. We haven't made investments in expanding trades. And what we're doing at the Department of Labor is really is creating more opportunities for registered apprenticeships. We're encouraging entrepreneurship. We're encouraging workforce development, job growth. We're encouraging making sure that we make these investments. The companies in Iowa in your district, we need to be having conversation with them about what they need out of job training for workers in the community.
Yeah, I would wholeheartly agree that collaborating with employers rather than looking to penalize employers is and having been an employer, I can say that what we're going through now is very vastly different than what we've gone through before in the past in looking for workers. And some innovative programs were launched in recent years to help improve opportunities and outcomes for disadvantaged youth. One of those programs, the Job Corps Scholars Program, allows Job Corps eligible youth to enroll in career and technical education programs at their community colleges to learn in-demand job skills. How did the department utilize this program during the COVID-19 pandemic to help young people continue their education despite all the challenges they faced in the midst of the pandemic?
Well, the problem that Job Corps had during the pandemic is the same that our schools and colleges had. A lot of these kids were sent home to learn online. Colleges were shut down, learning online. And the difference is that getting kids back into Job Corps, I think we've lost a little bit of some of our kids coming back into Job Corps. Right now, I want to say we have about 12,000 people in person. We have another 20,000 people online. My role is to get everyone back in person at Job Corps, and I want to realign the Job Corps program. I think there's a huge opportunity being missed in this country right now with 57,000 people going through Job Corps every year. We should be making sure that those folks, by the end of their time at Job Corps, whether it's a year or 2 years, that they're partnered with an employer with a job. And I mean, it just makes sense. So, Job Corps, in similar cases to schools and high schools and colleges, have went through the same challenges.
When Assistant Secretary Parker appeared at the Workforce Protection Subcommittee on May 25th, I asked him if OSHA has an estimate of how many taxpayer dollars were wasted in pursuing vaccine and testing mandate. He was unprepared to answer my question, but I'm hoping you might be able to provide an answer. Do you have an estimate?
No, I mean, again, the Department of Labor did not put a mandate out there. What we did was we went for a rulemaking on process on vaccinations or testing, which meant that and the Supreme Court voted down, so we know that. And so that's gone now, that's beyond there. But we weren't spending money on vaccinations in the Department of Labor. What I wanted to do was create that vax or test option. It was not a mandate.
So I'd hope, though, however, you would commit to providing the committee with information on how much was spent on a vaccine and testing program and
yeah, if there's dollars spent to it, I'll get it to you.
So, thank you, Mr. Secretary. I'd like to talk to you a little bit different about step therapy. I'm a physician, former director of the Department of Public Health, also military veteran. And so I want to talk about step therapy and how it relates to the ERISA health plans. I know the burden that's placed on providers by extended prior authorization stuff, such as step therapy, which is essentially a failed first requirement. And it certainly leads to people failing therapy, going to the emergency room, and being hospitalized when they were on a medication that was successful for them. It requires patients to try different medications and treatments before they can access the right treatment, even if they had the right treatment in the past. It can lead to burdensome delays of care, severe and even irreversible damage to patients, which is why I'm a proud co-lead of the Safe Step Act, along with my colleagues, Representative McBath on this committee, Dr. Winstrup, and Dr. Ruiz. Our bill takes care of patients first and considers patient medical history by providing a transparent plan to provide an exception process for patients. Over 30 states across the nation have passed very similar laws to the Safe Step Act, including Iowa. These laws apply to state-regulated plans, namely marketplace plans and many fully insured plans. They do not apply to self-insured employer plans, which are governed by ERISA under the Department of Labor. My question is, do you commit to work with Congress to eliminate the burdensome delays in care caused by prior authorization by helping us implement a solution like the Safe Step Act?
Yeah, let me get back to you on, let me work with your team on that. I'm not as familiar with that as I should be at this particular moment, but we'll work with you on that.
We would love to work with you on that.
Thank you.
So thank you, Mr. Chair. I yield back my time. Thank you, Secretary Walt.